Hi, Dr. Corey Welchlin from the Center for Specialty Care. I'd like to talk to you today about the OsteoArthritis Centers of America program treating the knee pain non-operatively. Orthopedic surgeons typically operate on knees, but we also treat knees non-operatively. The OA program is a program that helps relieve pain in knees 85% of the time and improve function in the knee 85% of the time. We've been doing this program for several years and have hundreds of patients that are very happy with their knee without having a significant surgical intervention. I'd like to show you a short video of the injection of the knee, and then I'll explain the program further. This is Margie. She's here for her 5th Supartz injection of her right knee. And Margie, how many injections did it take till you really started to feel better?
I would say number 3, about after I had the 3rd one, I started feeling better.
Okay, so you prep some betadine, then we use some skin freezing medicine to take the sting off the skin. And then we use some local anesthetic to go into the knee to numb that up. Picture. That shows that I'm in the knee nicely. I take the anesthetic off. This is the contrast to prove you're in the knee. And studies say that about 25% of the time, picture, there we go, that proves we're in the knee, that when people think they're injecting the knee joint, they're really not quite in, and so the outcome's not so good. So we always use contrast when we do this to prove we're in the knee. Right now, one more picture, and that again proves we're in the knee, and that's including the 5th injection. So how much does that hurt you, Margie?
Not at all, actually.
Not at all.
And I like that you are doing it under fluoroscope or whatever you call that, because that made a difference when I did not have it done that way.
So it's been very good for, so overall, compared to before, how much better are you before compared to before the injections?
Really good. I can sleep at night. I was waking up in the middle of the night, burning knee. I had to put ice on, take a lot of ibuprofen, and it was miserable. So now I'm comfortable. I'm sleeping through the night. I'm moving more, going up and down stairs easier. And I'm not going sideways downstairs, I'm going up and down the normal way.
So that's been very helpful. So the reason we have the OsteoArthritis Centers of America program, the OA program, we can help a lot of people with their knee pain who aren't ready for a knee replacement or a major surgery by doing the bracing, the injections, and the rehab. And her outcome and her progression is quite normal for what we're seeing. And we usually get 6 to 12 months or longer improvement. So we can repeat this pending insurance company's approval, but rarely are people not happy way beyond 6 months to a year. As you can see, the injection of the knee was relatively pain-free. We numb the skin and we inject the knee under fluoroscopy or x-ray imaging or under ultrasound. Without using ultrasound or fluoroscopy, 25% of the time the needle's not within the knee, so this is a significant, important portion of the treatment of the knee with these injections. Those rooster comb injections are injected either 1 time, 2 times, 3 times, or 5 times. Depends on the insurance company, what's required by the insurance company to inject the knee. We also do a structured physical therapy program with bracing. Again, the program is wonderfully successful with 85% of relief of pain and improvement of function. Call the Center for Specialty Care at 507-238-4949 and we'll get you in the program. Thank you.